I and XR-powered digital therapeutics for neurological healthcare. Imagine David, a stroke survivor, left grappling with mobility and speech challenges after weeks in the hospital. Traditionally, recovery would mean traveling to a rehabilitation center for in-person therapy, a vital but often slow, expensive, and infrequent process. This has been the experience of many patients with neurological conditions like strokes or traumatic brain injuries, TBIs, where long-term impairments demand sustained care. Enter digital therapeutics, DTX, a transformative solution offering patients like David personalized, real-time rehabilitation in the comfort of their homes. Through AI-powered platforms, David can now access speech and physical therapy tailored to his progress, all from his phone. Instead of waiting for clinic appointments, he engages with interactive language exercises and mobility drills that adapt based on real-time data, helping him recover faster and more effectively. For stroke patients with aphasia, speech recovery is slow and repetitive, but DTX makes it more engaging. Imagine David using an AI-driven app designed as a game, where he practices word repetition, and the app adjusts the difficulty based on his progress. What would have been a monotonous drill now becomes an interactive, motivating challenge that keeps him engaged in therapy at home. The app's AI tracks his responses and offers personalized interventions, propelling his recovery forward. Similarly, for Sarah, another stroke survivor struggling to walk, DTX combines music therapy and neuroscience to create a unique rehabilitation experience. Sarah's app synchronizes rhythmic music with walking exercises to stimulate her brain's neuroplasticity. As she walks to the beat, sensors on her phone analyze her gait and provide real-time feedback, adjusting the exercise difficulty to match her recovery progress. This VR-enhanced therapy doesn't just restore her mobility, it reduces her reliance on in-person visits while giving her tailored guidance daily. For individuals with chronic neurological conditions like multiple sclerosis, MS, flare-ups can disrupt rigid therapy schedules. DTX apps offer the flexibility to track symptoms and adjust interventions in real time. Patients like Sarah, dealing with unpredictable flare-ups, benefit from constant support through health coaching and symptom monitoring. The system adjusts to their daily needs, empowering them to manage their condition without the restrictions of traditional care. In underserved or rural areas, DTX bridges the gap. Patients who might otherwise struggle to access regular rehabilitation can now continue their recovery from home. Telemedicine and remote monitoring tools allow clinicians to adjust treatment plans based on real-time progress, ensuring patients aren't left behind. One of the most groundbreaking aspects of DTX is its holistic approach. Traditional neurorehabilitation often focuses on isolated symptoms, but DTX integrates physical, cognitive, and emotional care. For example, as David makes progress in his speech therapy, the app tracks his emotional well-being, offering mindfulness exercises to manage the stress and frustration that come with recovery. His therapy adapts to him, not the other way around. DTX apps are also designed with caregivers in mind. Family members can track their loved one's recovery, receiving guidance on how to assist at home. For David, his spouse is kept in the loop, seeing how his speech therapy progresses and receiving real-time suggestions on how to support him during conversations. This integrated approach makes recovery a shared journey, not an isolated struggle. Gamification keeps therapy engaging. Sarah's DTX app turns her mobility exercises into a game, where she earns rewards for hitting daily milestones like walking a certain distance or maintaining balance. These game-like elements not only keep patients motivated but also improve long-term adherence, a key factor in successful recovery. As AI and big data advance, DTX continues to evolve. Real-time data collection allows doctors to make data-driven adjustments to treatment plans, while predictive algorithms can foresee future challenges. AI models could eventually predict which patients will recover quickly and which may need more intensive interventions, optimizing resource allocation and ensuring personalized care at every step. Take Sam, a stroke patient with hemispatial neglect, a condition where he struggles to notice objects on one side of his environment. His DTX app uses extended reality, XR, to create immersive virtual environments that help him retrain his brain to recognize his left side. Sam reaches for virtual objects in the game, and the system tracks his movements with precision, adjusting exercises in real time based on his progress. What was once a frustrating, isolating condition is now treated with an interactive, personalized therapy he can engage with from his living room. Another revolutionary approach involves rhythmic auditory stimulation, RAS, and augmented reality, AR, for patients like Maria, who struggles with balance and movement after a neurological injury. Maria's app plays rhythmic music while using AR to create a virtual landscape for her exercises. The rhythm encourages her to match her steps to the beat, retraining her brain to walk with better balance. Sensors track her movements, providing instant feedback and adjusting the tempo to ensure a safe, yet challenging, pace. For chronic conditions like MS, where physical and emotional health are closely linked, DTX helps manage both. A DTX app designed for CNS conditions offers a suite of tailored exercises to improve mobility, cognitive function, and emotional well-being. For Marcus, a MS patient, the DTX app transforms his smartphone into a powerful rehab tool that tracks his movements, adjusts his therapy, and provides evidence-based interventions, all without needing extra hardware. The app offers real-time feedback, ensuring that Marcus is always working at the optimal difficulty level, keeping him engaged and motivated throughout his recovery. For Sarah, an MS patient battling depression, DTX apps offer computerized CBT, CCBT, providing a lifeline when traditional therapy feels out of reach. Sarah's app helps her identify negative thought patterns and replace them with healthier alternatives, all while tracking her emotional state. It offers mindfulness exercises to combat fatigue and anxiety, ensuring Sarah receives personalized, immediate support for both her mental and physical symptoms.